Hello, my name is Melissa. I'm a nurse here within the Village's Health as well as a population health specialist. Today's seminar is going to be on cholesterol. First, we're going to start out watching a short video from health.org to explain what cholesterol is. You might need to adjust your sound. Hopefully it'll be able to come through so you can see this as well.
Cholesterol. It's essential for your well-being. But what do you really know about it? Let's start with the basics. What exactly is cholesterol? Well, it's a waxy, fat-like substance that's made in your liver and travels throughout your bloodstream. It's a key ingredient that your body needs to make new cells. But too much cholesterol can lead to serious problems, such as heart disease and stroke. Here's why. You see, there are actually two main types of cholesterol, LDL and HDL. LDL, or low-density lipoprotein, sometimes called bad cholesterol, because it can build up inside your arteries, which causes them to narrow, which can lead to heart disease or stroke. That's why you should try to keep your LDL low. Think of it this way. The L in LDL is for lower or lousy. On the other hand, HDL, or high-density lipoprotein, is the good kind of cholesterol. It carries LDL, the bad stuff, away from your arteries and back to your liver, where it's broken down and processed by your body. That's why you want your HDL to be higher. In this case, the H in HDL is for higher, or healthy. There's actually a third component known as triglycerides, which plays a role in your cholesterol health. Triglycerides are the most common type of fat in your body. Their job is to store excess fat from your diet. Elevated triglycerides, along with low HDL and high LDL, can also increase your risk for cardiovascular disease, so it's important to keep your triglyceride levels low. For anyone who's had their cholesterol checked, it's only natural to focus on your cholesterol score, or the actual numbers. But the numbers don't really tell the whole story about your health. That's why it's important to discuss all of your risk factors with your healthcare provider, including risk factors that you can change, like eating a healthy diet, getting plenty of physical activity, and quitting smoking. Controlling your cholesterol may be easier than you think, but it all starts with getting your cholesterol checked. It's a quick and easy test. So if you're due to have your levels checked, or if you've never had them checked, make it a priority. Taking the next step in managing your health is as easy as CCC. Check, change, and control your cholesterol. Get started now by visiting heart.org/cholesterol.
All right, so the American Heart Association does provide us with a lot of good resources for not just cholesterol, but other things as well. So it's a good site to save and have on hand should you ever need it. So www.heart.org. So just as definition says, cholesterol is a soft wax-like substance that our body uses. Now we need cholesterol because it helps protect nerves, make cell tissues, produce certain hormones like estrogen, as well as cholesterol helps in our digestion. Our liver actually makes up all the cholesterol that our body needs. So excess cholesterol can be beneficial. We'll go over that in a little bit more detail further on. One of the studies by the CDC, the Center for Disease Control and Prevention, in 2016 showed more than 12% of adults aged 20 and over has a total cholesterol of 240 or higher. So that's considered high cholesterol. That's roughly 29 million people. That's in 2016, so 4 years ago. And the numbers are just steadily climbing. First, I want to talk about what our cholesterol is composed of. So when your doctor orders your lab test, just for those routine screenings, when you look at your lab report, you might see what's called a lipid panel or a cholesterol panel. So we're going to dive a little deeper and explain those now for you. Lipoproteins are fats, or also called lipids, on the inside, and proteins are on the outside. This encapsulates cholesterol, triglycerides, and other fats to allow the circulation throughout the body in the bloodstream. So you're going to hear lipoproteins a few different times throughout the seminar. So first up, we're going to talk about low-density lipoprotein. You might see it called LDL or hear it called LDL on your lab tests. This is what we refer to as the bad cholesterol. So just remember the L in LDL stands for lousy. This makes up the majority of our body's cholesterol. The LDL carries cholesterol to the cells of our body, including the arteries that supply blood to our heart and brain. So if we have excessive amounts of the LDL, of the bad cholesterol, it's taking these little chunks of cholesterol to the arteries that carry the blood into our heart and brain, and buildup of cholesterol could then cause a blockage. Like at the bottom, having high levels can eventually lead to heart disease or stroke. So you want to make sure you're keeping a close eye on your levels and not letting it get out of control and get in that high range. So your LDL, low density lipoprotein, L stands for lousy. This is the bad cholesterol. Now, on the other hand, the high density lipoprotein, or HDL, is the good cholesterol. So the H can stand for happy, or it can stand for healthy. This is the good cholesterol, however you want to remember that. So your HDL carries cholesterol, triglycerides, and other fats away from the arteries and back to your liver, where it's then passed from the body. Your HDL makes up about 1/4 to 1/3 of your blood cholesterol, and having high levels of the HDL can actually help protect you against heart disease. So if you have high levels of your LDL, that could take cholesterol and potentially cause a blockage. But if you have high levels of your HDL, that helps clean those bad cholesterols out and take it out of your body, which is what we want. So we want low LDL and high HDL numbers. Now, another one you're going to see on your lab test, or your doctor may discuss with you, are your triglycerides. They may be abbreviated on your lab test as trigs, T-R-I-G-S. This is actually a type of fat in the blood and in your fat tissue. Having high triglycerides can contribute to the hardening and narrowing of your arteries. This also puts you at a higher risk for heart disease and stroke. Any excessive calories that you take into your body are actually converted into triglycerides. And then having any pre-existing conditions like diabetes, obesity, kidney failure, or even alcoholism can actually lead into high triglycerides. So again, making sure you're staying on top of all of your lab tests, making sure you're doing those screenings that your doctor suggests, because we can't see what's happening on the inside of our body. And we may not know something is wrong until it's too late. So that's why those screenings are very important, to make sure we can keep up with everything inside. So we're going to talk about our numbers. Now keep in mind, these are just the baseline numbers. Your doctor may have a specific range for you. So it's a good idea to have that talk with them and see where they want all of your numbers to stay within. So first we'll talk about total cholesterol. Now there's 3 different ranges we have here on our baseline graph. So at the top, you can see the best would be to have your number less than 200. Now, if you remember in the first slide we talked about, most people have a cholesterol over 240. like 19 million people. So that's a very high number, and that's considered high cholesterol here at the bottom. 240 and higher is considered high cholesterol. So a lot of people don't have those routine tests and may not even know it. Now your LDL, can you remember, is the LDL the good or the bad? What does the L stand for? That's your lousy. That's the bad cholesterol. So ideally, we would want our LDL less than 100. I'm sorry. But you can see here, if you have a history of heart disease, your ideal goal would be less than 70. So if you have no history of heart disease, you want your LDL below 100. If you do have a history of heart disease, ideally your LDL should be below 70. You can see the other ranges here, near best, borderline high, high, and very high, which is 190 and higher. So keeping a close eye, making sure you're not steadily going up into those other categories is important. Now your HDL, this is your happy, healthy cholesterol. This is the good one. Ideally, we would want our cholesterol, our HDL cholesterol higher than 60. You can see there is a slight difference between men and women. So you would be considered at risk for a woman, your score less than 50. For men, if your HDL is less than 40. So for men and women across the board, ideally it should be higher than 60. That's a good goal to set. And then the triglycerides. These are, you can see the difference in the range for the desirable score. Your level should be less than 150. And then at the other end of the spectrum, very high is considered 500 and higher. That's a pretty dramatic difference there with the ranges. And we've even seen some of these scores nearing 900 and 1,000. So it's definitely a good idea to keep a close eye, because these put you at a very high risk. If they're out of the desired range and into the borderline high or very high range, you're at a high risk for developing heart disease and stroke. So we're going to talk a little bit about the dangers of having high cholesterol. We talked a little bit, puts you at a higher risk for heart disease and stroke, but we'll dive a little deeper into that. So the top picture on the left, picture A, is a normal artery. You can see the cross section where it's a nice circle, it's a nice opening for our blood to travel and transport into the rest of our body. But picture B on the bottom, you can see the plaque buildup. That's the plaque, the cholesterol buildup, and you can see in the cross section, now that nice circle is being narrowed, and the blood only has about half of the artery to be able to transport the blood to the rest of our body. So plaque buildup can lead to atherosclerosis, coronary heart disease, angina, which are the symptoms usually related to a possible heart attack, could also lead to a heart attack and even stroke. So having the narrowing of your arteries is not letting the blood and oxygen get to certain areas that it needs it, and then you could be at a higher risk for developing any of these conditions. So some things that you can do to hopefully prevent from developing high cholesterol, or if you have high cholesterol, to treat it and keep it within a well range. So obviously, to achieve the optimal cholesterol, there are some things that we know we need to do. So those routine screenings that our doctor suggests, making sure you do your lab test, going to your doctor for those preventative visits, so they can do all of these tests on you, are important, because we don't have x-ray vision. We can't see what's happening inside. We have to rely on these tests to tell us if something is happening or changing. Also, it's important to make sure you eat a healthy diet, as well as maintain a healthy weight. You want to also make sure you're incorporating exercise into your daily routine. Don't smoke. We know smoking is not good for our health. And then if your cholesterol numbers do start to climb up, make sure you do follow the treatment plan that your doctor suggests. So hopefully we can get your numbers back down to the goal where they should be to get you out of that high risk level. So with those routine screenings, on average, adults should have a fasting lipid profile. That's a fasting cholesterol panel every 4 to 6 years. Now that panel or profile would include your total cholesterol, LDL, HDL, and your triglycerides. Now, after the age of 40, 40 to 65, your doctor may start suggesting you do these tests more often. Sometimes they can even be suggested every 4 to 6 months if you are borderline or if you have a family history, just so they can keep a closer eye on you and make sure your numbers aren't slowly climbing. Now, this is a great website you can go onto. It's also from the American Heart Association. It's called Check Change Control Calculator. You can Google this or go on the Heart Association. It's cccalculator.ccctracker.com. So this is where you're going to put in your information. You'll put in your age, your cholesterol numbers, your blood pressure numbers, as well as any of the options. It lists for your medical history if you have any of those. It'll give you some more information and get you on the path to a stronger, healthier lifestyle. So we do reference the Heart Association quite a bit. Now, another test that can be done, this depends on the physician if they like to order this. It's called a coronary artery calcium score or measurement. This is actually a test that can measure, it'll take cross-section pictures of your vessels that supply the blood to your heart muscle to see if there is any plaque buildup. Now, keep in mind, some physicians do not like to order this test because a lot of insurances don't pay for it and it is pricey. So if your risk is uncertain, maybe the doctor does not have all the information on you, and the treatment options maybe are unclear, they may talk to you about ordering one of these, but it really varies physician to physician if this is a test that they like to get to better decide treatment plan for a patient. So on to diet. From a dietary standpoint, the best way to lower your cholesterol is to reduce the amount of saturated and trans fats that you're eating. The American Heart Association actually recommends limiting your saturated fat to 7% of your daily calories, and then minimizing the amount of trans fats that you eat, if not completely eliminating the trans fats. Now, this is an example of some saturated fats here. You'll see you have your greasy bacon, your cheese and dairy products, your red meats, then your margarines. The American Heart Association recommends no more than 13 grams of saturated fats each day. So just another way to look at it, no more than 13 grams of those saturated fats. And you can usually look on the nutritional facts for most of your foods that you buy at the store, and it'll give you the amount per serving. If you're going out, a lot of the big chain restaurants have their nutritional facts now listed on their websites, so you can get a lot of this information there as well. Now, this picture might make you a little hungry. These are some examples of trans fats. These are the ones that we want to very much limit, if not eliminate from our diet. So we have those sweets, you see the donuts, the chocolate chip cookie, we have the greasy fried foods, then we have our stick margarine there. So these are ones, like I said, if you can eliminate them completely, fantastic. If not, you need to minimize the amount that you're eating. So a heart healthy diet is suggested for your cholesterol. So that would mean eating lots of fresh fruits, veggies, whole grains, poultry, fish, nuts, and then using healthier oils to cook with. Eating this way can also help to increase your fiber intake, which is beneficial, especially as we age. A diet high in fiber can help to lower your cholesterol numbers by as much as 10%. So that's a lot if you really think about it, just with changing your diet, changing the types of foods that you eat and incorporating these foods that we have for the heart healthy diet, 10% can be a big change. Now with the oils, try to choose oils with less than 4 grams of saturated fat per tablespoon, and try to get some that have no partially hydrogenated oils or trans fats. So we want to avoid the hydrogenated oils and avoid the trans fats, and try to limit the amount of saturated fats that they have as well. These are some unsaturated fats that are better options for us. So you can see in the pictures and the list there. So your nuts, vegetable oils, canola, olive oils, safflower and sunflower oil, and then avocados, soybean, corn, walnuts, flaxseed, and then even some fish are considered omega-3 polyunsaturated fat sources. Those are good. So trout, herring, and salmon, those are the good omega sources that give us the unsaturated fats that are beneficial. So continuing with that heart healthy diet, this next topic is quite interesting when we're having the seminar in the office here when we start talking about alcohol. So the studies have shown and the researchers have determined that if you don't drink, don't start. A heart healthy diet, no matter what your neighbor or friend says, even if they suggest drinking 1 glass of red wine for dinner, if you're not a drinker, you shouldn't start. You can get the same benefits from eating some grapes. So if you don't drink, don't start. If you do drink, try to only drink in moderation. The suggested serving amounts for women is 1 drink per day. For men under the age of 65 is 2 drinks per day. But for men 65 and over is 1 drink per day. Now in the picture to the right, you can see what is considered 1 drink, 1 serving. So you have a 12-ounce can of regular beer, 5 to 9 ounces of malt liquor, 5 ounces of wine, or 1.5 ounces or shot of 80 proof hard liquor. Now these are each considered 1 serving. So you cannot save your servings up until Friday or Saturday date night. You cannot do that. This is literally per day. If you don't have any drinks today, tomorrow you still just get 1 drink. You don't get to bring over your one that you didn't drink today. It is 1 drink per day. If you don't drink today, that's okay. Tomorrow you still get 1. So size matters considering the amounts of the alcohol that you're drinking. But again, if you don't drink now, you shouldn't start. Now, going now to maintaining a healthy weight. If you're considered in the overweight range, that tends to increase your LDL, the bad cholesterol, decrease your HDL, that's the good cholesterol, and also increase your total cholesterol numbers. So being overweight does exactly the opposite of what we really need. You should only be eating the calories that you need to maintain a healthy weight. If you are in the overweight range and you discuss with your doctor an exercise plan and getting an ideal goal weight goal for yourself, you should be exercising regularly, and you should aim for 1/2 pound to 2 pounds of weight loss per week. Now, if you're at a good weight right now, if you're within that body mass index suggested weight, you want to just make sure you're still incorporating some exercise regularly to stay where you are. And if this is a question, maybe something that you're not sure exactly where you are, but you want to start an exercise routine, you can participate in one of our body composition analysis screenings. We actually do them here in the office. It's a free screening. Takes about 10 seconds. And you'll come in, you'll tell your weight and, you'll tell your height and your age, and you'll step on a scale with your socks and shoes off, and it will then determine your weight, your body mass index, body fat percentage, basal metabolic rate, fat mass, fat-free mass, and hydration level. So in 10 seconds with your shoes and socks off, you get all of this information printed out on a little receipt. And this is a good way to track your progress over time. So if you're starting that exercise routine, maybe you're not noticing the pounds changing on your scale at home, but maybe your clothes are fitting a bit looser. So that could be because you're losing some of your fat mass. Your body fat percentage might be dropping, but your weight at home is staying the same. Well, that could be because you're losing fat percentage, but you're gaining muscle. So this is a really good way, a free way to participate and track your progress over time. Like I said, it's completely free. We do it at most of our care centers. The only restriction is if you have an implanted electronic device like a pacemaker, or if you're pregnant, you cannot participate just because of the way that it does measure. No registration is required. We do have it listed online on the Learning Center page. If this is something you want some more information on, you can go on there or give us a call and we'll be happy to explain that for you. So with your exercise, when you start to exercise regularly, incorporating that into your daily life, it will then help increase your HDL levels, the good cholesterol levels, and lower your LDL. So it'll bring your numbers, bad numbers down, your good numbers up. Your goal should be to aim for at least 30 minutes of moderate intensity on most, if not every day of the week. Now you can, in fact, break these down into shorter segments if you don't have a full 30 minutes. You can do 3 10-minute sets if you want, or however you want to break it up so you can fit it into your daily program. Now, keep in mind also when you're incorporating exercise into your lifestyle, you should include all 4 types of exercises for the full benefit. There are 4 types that we will discuss. So your endurance, strength, balance, and flexibility. Your endurance, those are the cardiovascular or aerobic exercises that are going to get your heart rate and your breathing a little elevated. That's going to help with the circulation of your blood, with the oxygen-rich blood, to get to all the different parts of your body. Your strength, balance, and flexibility, those are important as well. These all help with our risk for falls as well. It keeps your lower body muscles toned and strong. And then your balance and flexibility, that helps keep your muscles and your body loose to be able to keep that range of motion that you have. So all 4 parts should be incorporated into your exercise routine that you do. Trying to incorporate all 4 every day, if possible. So smoking is another big piece to cholesterol. Smoking will actually lower your good cholesterol numbers. It's been proven when a person who has high cholesterol smokes, the risk of coronary heart disease increases more than it would otherwise. So if you do smoke, when you quit, you can actually start to lower your cholesterol numbers just by quitting. So that's a good thing. If you are smoking, we have lots of resources in the state of Florida. You can go to quit smoking, stopsmokingflorida.gov. There's a lot of different websites. When you are smoking and you stop, that also helps to protect your arteries. And then if you are not a smoker, but you're around areas where there is secondhand smoke, try to avoid it if possible, because that exposure can cause some negative impacts on your health as well. Here's that website, the tobaccofreeflorida.com. A great website. They provide resources, even some lozenges, patches, and gum if you are or know someone that is trying to stop smoking. So this is another website. We're listing it on here. I'm not going to show it, but you're welcome to go on. It's from the American Heart Association. It also talks about some prevention and treatment for high cholesterol. Great resource. If you're able to watch that, we do suggest that, like heart.org. Then you can just click on the different links and watch all these different resources that they provide you. So now we're going to go ahead and move into the cholesterol medications. There are a lot, And depending on your medical history, as well as what numbers are maybe getting a little on the higher side, your doctor may suggest a certain medication to you. So we're going to talk a little bit about that. The different types of medication that can be given for cholesterol are on the left. So you have your statin drugs. Those are the most common that we see. You might hear simvastatin or atorvastatin, even Lipitor, Zocor, things like that. Again, those are the most common that we generally see. They do help lower your LDL and provide some pretty modest improvements in your triglycerides and HDL. Some of the other ones you see here, bile acid sequestrants, cholesterol absorption inhibitors, niacin or nicotinic acid, and fibrates. So depending on your medical history and what other comorbidities you may have, your doctor may or may not suggest the one listed here, the statins. They may suggest something else that might work better for your body. So statins may be recommended for people who already have a diagnosis of some type of cardiovascular disease, just to hopefully keep the risk of having an event at a lower level. Also with people with an LDL of 190 or higher, or people with type 2 diabetes who are between the ages of 40 and 75. It also may be suggested for people with an estimated 10-year risk of cardiovascular disease of 7-point higher, who are also between the ages of 40 to 75. So it may not just be because of your one number. There could be some other reasons why the doctor suggests that a statin may be beneficial for you. So these are some of those. If the doctor does suggest maybe a medication and you're not sure exactly why, ask them. Ask them if they could break it down a little bit for you to explain to you the benefits of why a statin would be beneficial for your health at that point. So if you have a better understanding, then you're more likely to take the medication. So it's a good idea to ask questions. So some other questions that you may want to ask your doctor, if you haven't already, am I at risk for high cholesterol? Maybe they can look at your previous numbers and see if there's a trend, maybe a couple points trend over the past 5 years in the higher range. You can also ask them, how often should you get your cholesterol tested? Now, earlier we talked about it could be every 4 to 6 years, but it also could be every 4 to 6 months, depending on your numbers, your previous medical history, family history, as well as your numbers where they're trending. Ask them what your numbers are. Most doctors are able to give you a printout of your labs, and you can actually keep track of them. You can keep a binder so you can see the trends yourself. And once you do get your copies, ask the doctor, what's your target? What is the range that they want your numbers to stay in? If you're noticing that they are starting to trend up, ask them if there's any lifestyle changes that they might suggest to help keep your numbers down or even improve your levels. If there is a trend as well, you can ask them, is there a chance that you'll need a cholesterol lowering medication in the near future? If so, then you can revert back any lifestyle changes that you can make at this time to hopefully keep that in the further future. And then if you get to the point where the doctor does suggest that a medication is needed at that time, make sure you ask them what the risks and benefits are of that medication. You want to find out what the common symptoms and side effects are, if there are any, so you know what to expect. You can weigh the risks and benefits and talk to your doctor about it and see if that is the right medication for you. These are some of the resources that we use throughout this seminar. We do reference the American Heart Association quite a bit. They're a wonderful resource. They have all different kinds of interactive pages on their site that you can go on to not only learn about cholesterol, but all other topics. The other one is the Tobacco Free Florida. That's if you or someone you know is wanting to quit smoking. And then the other where we talked about the coronary calcium score is from the Cath Lab Digest. If you have any questions, you can give us a call at the Villages Health Learning Center. We'd be happy to get your feedback, any questions or comments. And I hope you have enjoyed the seminar and gotten something from it. And we hope to hear from you in the future and join us in on some other seminars. Have a great day.